Welcome to Didactic, CAP Sports Study Edition. Today is Monday, 24 February 2025. I'm your host, Dr. O'Leary, a child and adolescent psychiatry fellow in the National Capital Region. This is a podcast I designed to help myself and other child and adolescent psychiatry fellows study for their boards. But anyone interested in human development and mental health will also get something out of it. I am using artificial intelligence to assist me with the content creation. And when I first began making this podcast, I had used AI only to help summarize and organize the content. Now, I have a tool that allows me to feed an AI high-quality, peer-reviewed articles and book chapters, and it will generate an actual audio discussion of the content. I provide this AI tool with a select group of papers, and then give it multiple different prompts, each of which produces about a 10 to 20 minute audio file. Then I review the audio, remove obvious mistakes, repetitive content, and annoying interjections, and then I paste it all together. Some of the mistakes that the AI commonly makes are pronunciation errors. For instance, it cannot seem to pronounce the word norepinephrine, which listeners will notice during this episode. It also is poor at citing sources. And while it's not just making up content or making up sources like it used to last year, it often mixes up where the information came from. I've found it to be extraordinarily accurate, but not very precise. I'm listing the references that I feed into the AI in the show's transcript, and that's located at didactic.buzzsprout.com. So if you want to know what I fed it, you can go there and find the transcript. If you want to give me feedback on any episode or just feedback in general, or you want to yell at me or something, you can send a message to feedback@didactic.com or fill out a form on the website at didactic.com. That's PSYDACTIC.com. Well, that's enough of me talking today. Enjoy today's AI-generated discussion of ADHD, its etiology, epidemiology, and differential diagnosis.
Hey everyone, and welcome back to the Deep Dive.
Glad to be back.
Today we're diving into something especially relevant to all of you out there in the psychiatry and psychology world.
Oh, yeah. What's that?
ADHD.
Ah, yes. Attention deficit hyperactivity disorder.
A condition that's so common but
Yeah.
often misunderstood.
Absolutely. And
And there's a lot of debate surrounding it.
Mhm.
That's why we're going beyond the textbook today to unpack the latest research,
Okay.
the clinical consideration,
Right.
all the stuff surrounding ADHD.
I like it.
We're going to start with the fundamentals.
Okay.
The DSM-5 definition.
Okay.
What we think is happening in the brain,
Right.
the prevalence of this disorder.
Mm-hmm.
Then we'll get into the really complex stuff,
Okay.
diagnosis, how to
Yes.
tell ADHD from other conditions,
Right.
the overdiagnosis debate,
Mm-hmm.
and then finally we'll touch on the disparities we see in diagnosis,
Okay.
which, as we all know, is super important for all of us to consider.
It really is.
So where should we begin?
Well, let's lay the groundwork first.
Okay.
What exactly is ADHD according to the DSM-5?
Yeah, that's a good place to start.
Well, the DSM-5 defines it as a persistent pattern of inattention and/or hyperactivity impulsivity
Mhm.
that interferes with functioning or development.
Okay.
And this has to be present before the age of 12,
Okay.
and in at least two settings like home and school.
So it's not just a kid who's a little fidgety in class.
Yeah,
sometimes.
no, it's got to be consistent, a
Right.
real pervasive pattern that's causing problems.
Okay.
And, the DSM-5 also outlines three subtypes of ADHD.
Oh, okay.
Predominantly inattentive, predominantly hyperactive impulsive,
Okay.
and combined presentation,
Got it.
which, helps capture the fact that ADHD can look very different in different people.
Right. So like a kid who's always daydreaming,
Yeah.
struggling to follow instructions.
Yes.
Might have the inattentive subtype.
Mm-hmm.
Whereas a child who's always on the go
Yes.
and blurting out answers,
Yeah.
that might be more of the hyperactive impulsive subtype.
Exactly. And of course, a lot of kids exhibit a combination of both.
Right, right.
So that brings us to the question of why.
Yeah.
Why do some people develop ADHD?
What do we know about the underlying causes?
Right. What's going on in the brain?
Is it purely biological or?
Well, the research seems to point to a complex interplay
Okay,
of genetic and environmental factors.
okay.
Twin studies have shown that ADHD has a heritability
Mm-hmm.
of around 60 to 70%.
Wow.
Yeah,
That's
look,
pretty strong.
it's a pretty strong genetic link.
Yeah,
But
but it's not the whole story.
of course not.
Yeah.
Environmental factors play a role too.
Okay.
Things like exposure to toxins during pregnancy, low
Mm.
birth weight, even just psychosocial stressors in childhood, these can all increase the risk of developing ADHD,
So it's nature and nurture.
as with so many
Yeah,
things.
as with so many things in mental health. But what about the brain itself?
Okay.
Are there any specific areas or pathways?
There are some interesting findings coming out
Uh-oh.
from neuroimaging studies.
Okay.
Research suggests that individuals with ADHD may have differences in brain structure
Okay.
and function,
Interesting.
especially in areas related to attention,
Uh-huh.
executive function,
Okay.
and impulse control.
So we're talking about areas like the prefrontal cortex,
Exactly.
the basal ganglia.
Yeah, those sorts of regions.
Okay.
They found a developmental lag in cortical thickness in children with ADHD. Cortical thickness is basically talking about the outer layer of the brain, and this study showed that in kids with ADHD, this outer layer was developing more slowly compared to their peers who didn't have ADHD. It's almost like their brains are on a slightly delayed schedule.
So it's not that their brains are damaged, just developing at their own pace.
Right. And there's also growing evidence
Mm.
suggesting that neurotransmitter systems, particularly those involving dopamine
Mm-hmm.
and norepinephrine,
Right.
might be dysregulated in ADHD.
Which makes sense,
Yeah.
given that dopamine's involved in reward processing and motivation,
Mhm.
and norepinephrine plays a role in alertness and attention.
Right.
Yep.
So, and this neurobiological understanding is really crucial
Yeah.
because it helps us move away from those outdated notions
Right.
that ADHD is simply a matter of willpower
Yeah.
or bad parenting. It's a neurodevelopmental disorder
Yeah.
with real biological underpinnings.
Right.
And it's surprisingly common.
Is it?
Current estimates say that ADHD affects somewhere between 5 and 9% of school-aged children in the U.S.
So in an average classroom, you might have
You could have.
2 or 3 kids who meet the criteria for ADHD.
Yeah, potentially.
Yeah.
And the impact of this disorder can be significant, not just for the individuals themselves,
Right.
but also for society as a whole.
Oh, yeah.
The economic costs associated with ADHD are estimated to be over $143 billion annually.
That's a staggering figure
It is,
in the U.S. alone.
just in the U.S.
It really highlights the need for early identification
Yeah,
and effective intervention.
absolutely.
Okay, so we've got the basic definition,
Mm-hmm.
potential causes,
Okay,
and the prevalence of ADHD.
right.
Let's move on to the process of actually diagnosing this disorder.
Okay.
What does a thorough ADHD evaluation look like?
Well, a thorough evaluation goes far beyond just observing a child in a single setting.
Okay,
It's about gathering information from multiple sources,
okay.
really piecing together a comprehensive picture of
Mhm.
their developmental history and current challenges.
So it's not just about asking the child a few questions.
Right.
It's about talking to parents, teachers, maybe even other caregivers.
Yeah, anyone who interacts with the child regularly,
Right.
we need to understand how the child's behavior is showing up in
Mhm.
different environments and how it's impacting their functioning in those settings.
Okay.
We also need to consider developmental milestones and rule out other conditions
Yeah.
that might be contributing to the symptoms.
So a child who's struggling to pay attention in school
Mm-hmm.
might have an undiagnosed learning disability, for example.
Or a child who's hyperactive and impulsive might be experiencing anxiety.
Okay.
It's so crucial to be able to differentiate ADHD from other conditions that can mimic its symptoms. And this is where a careful clinical history
Uh,
and a good understanding of developmental psychopathology
right.
come into play.
How do you know if someone's putting things off, procrastinating because they're afraid to fail?
Right.
Like that's anxiety.
Uh-huh.
Or because they're having trouble with executive function, which is more of an ADHD thing.
Yeah. Imagine a student who can't seem to get started on a paper.
Okay.
Are they frozen because they're scared of not meeting expectations? That's classic anxiety, right?
Yeah.
Or are they struggling with planning, organizing, and getting started on the task? The things that are typical with ADHD. It can be really hard to separate them, especially with how often they occur together.
That's what I find so interesting. We're not dealing with two things that are totally separate.
Nope.
We're talking about a huge overlap. Studies show that they show up together, what, somewhere between 26 and 50% of the time? Those are big numbers.
Yeah, it's more like a Venn diagram with a huge area where they overlap.
Are there any, like, red flags, any clear signs that can help us separate ADHD from anxiety?
There are one of the Key things that sets them apart is where the attention is focused. ADHD, a lot of times it shows up in outward behaviors, like you can see it. Things like fidgeting, interrupting, having trouble staying on task. But with anxiety, it's mainly an internal thing, like feeling distressed, worry, fear, that kind of apprehension. Think of it this way. Someone with ADHD might blurt out answers in class, not because they want to, but because they have trouble controlling those impulses. But someone with anxiety might not say anything at all. They're avoiding participating because they're afraid of being judged, being evaluated negatively. It's an internal thing that's making them act that way.
That's a really helpful way to think about it. But in real life, how do you actually tell those two things apart? What if a student doesn't participate because they're struggling with impulsivity and they're also scared of being judged?
You're right, it's not always so black and white. That's why it's important to look at another thing that's different, how consistent the behavior is across different settings. ADHD symptoms tend to show up everywhere: home, school, work, social situations. Anxiety, while it can be generalized, is often tied to specific situations. The symptoms get worse in certain places or situations.
So, okay, if a kid's having trouble focusing and they're hyperactive at home and at school, that might mean it's ADHD. But if it's mostly happening when they're performing, like at a piano recital, it might be more anxiety about that particular event.
Exactly, you're getting it. And keep in mind, these are just general trends. Every person is different. There are always going to be exceptions. But these patterns can be really useful when you're trying to figure out what's going on. And then, of course, we have to look at when these symptoms first show up, the developmental trajectory.
Right, like the timeline of when these symptoms first appear. Yeah.
Well, as you probably know, ADHD symptoms usually show up pretty early on in childhood, like before a kid turns 7. Anxiety can also start early, but it's not unusual for it to develop later, maybe during the teenage years or even adulthood. Often it's triggered by specific events or life changes.
Yeah, that makes sense. We can't ignore the big issue here, how often ADHD and anxiety happen together.
Absolutely not. That's really where the challenge comes in. I remember those numbers we talked about before. Studies are pretty consistent in showing that somewhere between 26% and 50% of people with ADHD also have an anxiety disorder.
Statistically speaking, if you're working with someone with ADHD, chances are pretty good that they're also dealing with anxiety. One of the things that really jumped out at me when I was going through these studies was how anxiety actually makes ADHD symptoms worse. It's not just that they happen at the same time, but they seem to make each other stronger.
Yeah, that's a big thing you found there. Research shows that anxiety can make those core ADHD symptoms worse. The inattention, the hyperactivity, the impulsivity. It's like throwing gasoline on a fire.
So someone who has both ADHD and anxiety, they might have even more trouble focusing, getting organized, and managing their emotions compared to someone with just ADHD.
Exactly. And that really changes how we think about treatment. Studies like that big MTA study have shown that for kids who have both ADHD and anxiety, the best approach is usually a combination of medication and behavioral therapy. So you're treating both things at the same time.
That makes a lot of sense. You can't just treat one and hope the other one just disappears.
Another common one we see along with ADHD is oppositional defiant disorder, or ODD. Kids with ODD are often defiant and argumentative. They might even be hostile.
Yeah, I could see how that could be hard to tell, apart from ADHD, especially the hyperactive impulsive type. How do you know which one it is?
It's subtle, but there are some important differences. Impulsivity in ADHD is often because they have trouble controlling their impulses, like they can't hit the brakes. But with ODD, the defiance is more intentional. It's like they're trying to challenge authority or push the limits. And that difference is really important because if they have ODD, it can change how you decide to treat them. The MTA study found that kids with ADHD, anxiety, ODD, and conduct disorder actually responded best to a combination of medication and behavioral therapy.
What about mood disorders? Those seem like they could easily be mistaken for ADHD as well.
You're right. There's definitely some overlap. For example, both ADHD and depression can make it hard to concentrate and can cause problems with sleep.
So how do you avoid getting those mixed up? What should you be looking for?
Well, both can cause low motivation, but the reasons behind it are often different. In ADHD, the problem might be with executive function and attention regulation, like their brain has trouble getting started and staying focused even on things they enjoy. But with depression, the lack of motivation is usually tied to feeling hopeless or sad or losing interest in things they used to love.
So you need to be asking about how the child is feeling, not just how they're acting.
Exactly. And you should also be on the lookout for other signs of depression that you wouldn't typically see in ADHD, like a consistently sad mood, feelings of worthlessness, or big changes in their appetite or sleep patterns. It's all about looking at the whole picture, not just focusing on a few symptoms.
Now, what about tic disorders? I imagine those to be confusing too, especially if you're not used to seeing them.
You're right. Text those involuntary movements or sounds can be really distracting and disruptive both for the child and everyone around them. And that can sometimes lead people to think it's ADHD, especially the hyperactive impulsive type.
So how can you tell the difference? What are some key things to remember?
Well, the most important thing is to remember that texts are completely involuntary. The child can't control them at all. While a child with ADHD might have a strong urge to move or talk impulsively, they can usually hold back for a little while or find a more acceptable way to do it. But texts just happen whether the child wants them to or not.
Right? They might be able to suppress the urges for a bit or choose to express them in a way that's not as disruptive. But with tics, they just happen no matter what the child wants.
Exactly. Also, tics often follow a pattern or have a trigger, while ADHD behaviors tend to happen more often and don't seem to be related to a specific situation.
And tics don't usually cause the inattention that's a hallmark of ADHD.
Now, it's worth mentioning that a child can actually have both ADHD and a tic disorder. In fact, Tourette's syndrome, which involves both motor and vocal tics, often occurs with ADHD more often than you would expect by chance alone.
So you need to be careful to check for both, especially if you see any signs of tics. Now, we've been talking a lot about differentiating ADHD from psychiatric and neurodevelopmental conditions, but what about the times when the real cause is a medical problem?
Ah, that's when your detective skills really come in handy. It shows how important it is to get a complete medical history and do a thorough physical exam. Sometimes what looks like ADHD is actually a sign of something else going on medically.
What are some examples of medical problems that could be mistaken for ADHD?
Sleep disorders are a big one, and they're often missed. Things like obstructive sleep apnea, where your breathing repeatedly stops and starts while you're sleeping, can make you sleepy and irritable and have trouble concentrating during the day.
And those symptoms could easily be mistaken for ADHD, especially the inattentive type.
Exactly. And it's not just sleep disorders, hearing or vision problems can also cause behaviors that look like ADHD. Imagine a child who's always asking people to repeat themselves or having trouble following directions. If they can't hear well, it's no wonder they seem inattentive or frustrated.
That's a good point. You have to make sure you're not mistaking sensory problems for attention problems.
Absolutely. Another thing to consider is side effects from medications. Some medications, like certain anticonvulsants or high doses of steroids, can cause changes in behavior that look a lot like ADHD.
So checking the child's medication list is a must during the evaluation. You have to rule out any medications that could be causing the problem.
Now, moving on to some less common but still important things to think about, we have genetic syndromes that can present with symptoms similar to ADHD.
Things like Fragile X syndrome, Klinefelter syndrome, and Turner syndrome come to mind. These are complex disorders that can affect development in a lot of ways.
And some of those effects can include problems with attention impulsivity and hyperactivity. For example, Fragile X syndrome, which is the most common inherited cause of intellectual disability, often involves behaviors that look like ADHD, along with anxiety and problems with social communication.
So you need to be extra careful to check for ADHD if you see a child with developmental delays or other signs that suggest a genetic syndrome.
Exactly. Now, it's important to remember that not every child who shows behaviors like ADHD has a biological or medical condition causing those problems. Sometimes the key to understanding what's going on lies in the child's psychosocial environment.
That's an important point. We can't forget about how much a child's experiences and environment can affect them.
Think about a child who's been abused or neglected or who lives in a home with a lot of stress. It's completely understandable that they might have trouble focusing and controlling their impulses or regulating their emotions.
Their behavior might be a reflection of their trauma or a way of coping with a really difficult situation.
Exactly. It wouldn't be right to say that those behaviors are solely due to ADHD without considering the impact of their experiences. It really shows how important it is to do a holistic evaluation, one that looks at every part of the child's life.
So we've talked about how important it is to make the right diagnosis, but what are some specific tools and strategies that can help us do that? You mentioned rating scales and clinical interviews before, but what else do we have?
Another useful tool is neuropsychological testing. While it's not always needed for an ADHD diagnosis, it can give us a really complete picture of a child's cognitive strength and weaknesses.
So it can help us find learning disability, problems with executive function, or other cognitive factors that might be contributing to their struggle.
For example, a child with dyslexia might have trouble with reading and writing, which can lead to frustration, avoidance, and behaviors that look a lot like inattention.
And neuropsychological testing can help us understand those complexities and make sure the child gets the right support, whether or not they end up being diagnosed with ADHD.
These tests provide a more objective
Right.
and standardized measure
Okay.
of a child's cognitive strengths and weaknesses.
So you might use these tests to look at things like attention span,
Exactly.
working memory,
Uh-huh.
processing speed, executive functioning.
Precisely. And the results can help us
Yeah.
not only to confirm or rule out ADHD,
Right.
but also to identify any co-occurring learning disabilities
Right.
or other cognitive challenges
Yeah.
that might be contributing to the kid's difficulties. One tool that can be really helpful is the Continuous Performance Test, or CPT. It's a computer-based test that measures a child's ability to pay attention and stop themselves from acting impulsively.
So it's a more objective way to measure those core ADHD symptoms.
Exactly, and it can help us separate ADHD from other conditions. For example, research showed that children with ADHD and anxiety were inattentive on the CPT, but not impulsive.
So that suggests that their inattention might be more because of worry and distractions in their head than a problem with controlling their impulses. It's a subtle but important difference. I know there's a lot of debate
Yeah.
about the diagnosis of ADHD,
Mm-hmm.
particularly overdiagnosis.
Right.
What are your thoughts on that?
Well, it's a valid concern.
Yeah.
It's definitely a conversation we need to have.
Mm-hmm.
There's a possibility that in some cases, yeah,
Okay.
we're too quick to label kids with ADHD, maybe misinterpreting
Yeah.
developmentally appropriate behaviors,
Right.
or overlooking other contributing factors.
So a kid who's just a little more energetic
Right.
or impulsive than their peers
Mm-hmm.
might get slapped with an ADHD diagnosis,
Yeah.
when in reality, they're just
When they're just a normal kid.
a normal kid.
Yeah, and there's research that shows the relative age effect
Oh, okay.
can play a role in diagnosis rates.
Interesting.
Younger children in a classroom
Yep.
are more likely to be diagnosed with ADHD
Okay.
than their older peers,
Interesting.
potentially because
Yeah.
they're just less mature.
Oh, wow.
Yeah,
So it might not always be a true ADHD difference,
right.
but rather a developmental one
Exactly.
that tends to even out over time.
Precisely.
That's
And this underscores the importance of careful and thorough evaluation.
Right.
We need to consider the child's age,
Mhm.
their developmental stage, their individual context
Right.
before jumping to conclusion.
It's about seeing the whole child,
Exactly.
not just a set of symptoms.
That's a great way to put it.
And I think that's a perfect segue
Right,
into the issue of disparities in ADHD diagnosis.
Right.
We know that certain groups of children are less likely to receive an ADHD diagnosis
Mm-hmm.
than others, even when they have similar symptoms.
Yeah.
Why do you think that is?
Well, there are several factors
Yeah.
that could be contributing to this.
Yeah.
One possibility is that there are cultural differences
Okay.
in how we perceive and interpret behavior.
Right.
So a child from a culture that values quiet attentiveness
Mm-hmm.
might be seen as inattentive
Yeah.
in a classroom that expects more active participation.
Oh, that's interesting.
And it highlights the need for clinicians to be culturally sensitive in their assessments.
Right.
We also need to consider factors like access to healthcare,
Mhm.
social economic disparities.
Right.
Children from marginalized communities might face more barriers
Yeah.
to accessing mental health services
Yeah.
and getting the proper evaluation.
That's a systemic issue that needs to be addressed
He really
at
does.
multiple levels.
Absolutely.
But I think another piece of this puzzle
Yeah,
is clinician bias.
absolutely.
Unconscious bias can influence how we perceive
Mm-hmm.
and interpret information.
Yeah,
And it can lead us to make assumptions about a child
right.
based on their race,
Uh-huh.
their ethnicity, or
Yeah.
socioeconomic background.
And this can have a profound impact
Yeah,
on diagnosis rates.
it's a sobering thought.
It is.
It means that we as clinicians
Yeah,
need to constantly be questioning
Right.
our own assumptions
right.
and biases
Yeah,
to make sure that we're providing equitable care
absolutely.
to all children.
I completely agree. We have a responsibility to advocate for systemic change.
Yes.
But we also have a personal responsibility to examine our own implicit biases
Yeah.
and strive for cultural humility in our practice.
This deep dive has really highlighted the complexities of ADHD diagnosis
It has.
and the importance of a nuanced
Yeah,
and individualized approach.
for sure.
We've talked about the diagnostic criteria,
Mm-hmm.
the underlying causes,
Yep.
the role of testing,
Mm-hmm.
the overdiagnosis debate,
Yeah.
and the disparities that exist in diagnosis rates.
A lot to think about.
It is.
And I'd add that it's also important to empower people with ADHD and those who care for them to understand their own path with knowledge, compassion, and most of all, hope.
That's a great way to end our conversation. Thanks for joining us on this deep dive. We hope you found it informative, thought-provoking, and most importantly, helpful for your practice.
This has been an episode of Psydactic, Child and Adolescent Board Study Edition. Nothing in this podcast should be considered personal, medical, or mental health advice.